Hello everyone, thank you for tuning in. I'm Dr. Michael Sistare, Palm Beach's newest cosmetic surgeon. I'm happy to have the opportunity to talk to you a little bit more about an issue that is brought up to me frequently that I wanted to bring some clarity to, especially regarding facelifts. So there's two major types of facelifts. There's a deep plane facelift and a superficial plane facelift. To distinct these, I have to go into a little bit of the anatomy of the face. If you go from the surface of the face downward, you run into a few different layers. First is the skin, underneath the skin is the fat, and underneath that you run into a layer that's a little bit like muscle, but a little bit like fascia, the covering of the muscle. It's called the SMAS, Superficial Musculo-Aponeurotic System, SMAS, S-M-A-S. So that is the layer that you're aiming to lift up that provides support to the skin when they're placed into their new positions. When you ask about a deep plane facelift, it's lifting up the area below the SMAS. If you're talking about a superficial facelift, it's just lifting up the area above the SMAS. There's been a lot of research into figuring out exactly what type of facelift is done for each person in order to get the best results. And it's come down to a pretty clear distinction. In general, unless you ask me specifically for a type of facelift like a deep plane facelift or a not deep plane facelift, I'm going to go off of one major criteria, and that's the age, your age. There's a major study done that asked the question, which facelift procedure is best? And what they found is the results cosmetically are better and more durable if the patient is above 70 years old, if they get a deep plane facelift. What they found, if the patient is below 70, doesn't matter what technique you choose, it's all going to look pretty dang good. So the question is, why would you pick one or the other from the surgeon's perspective? You have to ask yourself, is doing more surgery and potentially putting the patient in the position where you could inadvertently damage something that you're not looking to, is that wise if you're going to get the same results from a different procedure? So I would argue that you do as much as you can for one person, keeping in mind that they want a durable outcome, but you don't go overboard and do something that's not necessary. So more often than not, I won't recommend a deep plane facelift unless the patient has exceptionally sagging skin or very deep creases, or if they're an elderly patient above the age of 70. And the studies show that if I don't have to do a deep plane facelift, you're going to get just as good results that last for just as long if I just do a superficial facelift. So I just wanted to clear that up. The main two types of facelift, just to reiterate, are a deep and superficial facelift. The deep plane facelift is typically reserved for people who are older or have very wrinkling, very ptotic, sagging skin. I'm happy I had the opportunity to clarify that for you. Thank you so much for watching. If you have any more questions, please leave it in the comments below. And once again, the practice is Palm Beach Cosmetic Surgery. See you all soon.